Sarah, and with the threat of Ebola officially here in the United States, experts throughout the country are discussing the best precautions for preventing a spread of the deadly virus. The Center for Global Health is stressing the importance of containing the virus, suggesting any Americans who have traveled to West Africa in the last month should be quarantined immediately. Now, this morning we are talking to Dr. Steve Threlkeld. He is an infectious disease specialist at Baptist Hospital. Doctor, good morning. Thanks for being with us.
Good morning. Good to see you.
Okay, so starting with Ebola, how seriously should we be taking this threat of the virus here in the Mid-South?
Well, anytime you have a virus that historically has killed over 50% of its victims and is contagious, it's hard not to take it awfully seriously. And I think we have taken it seriously with the CDC, the state and local health departments, and the exercises like the one we just saw.
And so what can we do proactively to make sure that we aren't getting Ebola?
Well, I think one thing that people don't sometimes appreciate is that we need to support the efforts to stamp out this epidemic in West Africa, because that's really the source of it, and that's really the source that could potentially bring people to the United States. And also basically just to watch out for anyone who is a traveler from West Africa. We saw that one of the hospitals actually discharged someone from the emergency room, and it's hoped that anytime someone comes back from West Africa and has a fever or an illness like that, we should make sure that they notify the local health department to be checked out.
Something else that's been getting a lot of attention, especially concerning children, enterovirus cases reported in Mississippi and Tennessee. What symptoms do parents need to be looking for?
Thankfully, most of the people that come down with enterovirus 68 infection are fairly mild illnesses. I mean, a common cold sort of syndrome. What we have to watch out for is almost all children are the ones that have been hit hard by it, particularly ones with asthma or a tendency to wheeze. So parents need to watch out for any kind of cold that becomes more severe with coughing and wheezing. And parents with kids with asthma should probably have a plan already in place for illnesses like that with their doctor.
And if somebody does suspect that their child has come down with it, what do they need to do?
Particularly if they have a severe illness with wheezing and asthma, like we mentioned, they should talk to their doctor, go to the hospital if it's severe enough. Most of the kids with this may not realize that's what it is. It may be more like a common cold, and in that sense, they probably don't need to do anything particularly special, although if your kid is really sick, probably best to leave them out of school for a day or two.
And of course, flu season, coughing, sneezing, common things, but is there anything else that we should do to make sure that we're staying healthy beyond maybe getting our flu shot or the nasal spray?
Which we certainly need to do, of course, but the main thing is hand washing. Don't scratch your face or eyes with unwashed hands, particularly after shaking hands with someone else. That really is the basis and the first line of defense against the flu and most other viral infections for that matter.
And of course, we're focusing on lots of different viruses. Is there a threat to people out there they need to be more concerned with than others?
Well, anytime you look at viruses with a higher mortality per person, that tends to get most of our attention. But it's important to know that in the United States, on an average year, more people can die of the flu than have ever died of Ebola. So the flu is probably the one that saves the most lives to focus on. Get your flu vaccine is probably the best thing that you can do.
And how serious is the flu here in the Mid-South?
It's completely variable every year. We have very severe years where 40, 50,000 people across the country can die, and it can be variable from year to year and from region to region in the country. So we have to wait and sort of see when that epidemic breaks out, but to get your flu shot is the most important thing regardless.
And I know a lot of times people kind of think, oh, I didn't get my flu shot in the middle of flu season. Do you still recommend, even if they missed kind of getting in on the front end, go ahead and get it later on?
Absolutely. Just remember that you could get the flu up to 2 or 3 weeks after getting that vaccine. That doesn't mean the shot causes the flu. So sometimes people get the flu after getting the vaccine and they think the shot caused it. That's not true. But yes, anytime during flu season, go ahead and get it if you haven't gotten it.
And another thing, is it important people get a lot of rest during these times, lots of sleep? Does that help?
That always helps anytime. There's some studies that show that people that get adequate rest are less susceptible to viral infections. That's variable from person to person, certainly, but it's just a good idea for your general health anyway.
Okay, Dr. Threlkeld, thanks so much for coming in and being with us this morning.
You bet.
Coming up on Good Morning Memphis, hundreds